Hi guys, my name is Susan McKillop, and today I'm an asthma educator at Weill Cornell Medicine Pediatric Asthma Program. Today we're going to talk about spacer use. Okay, our objectives today are to talk about how does the asthma medication actually get into your lungs. We're going to talk about important things that you need to know about your spacer. We're going to do a demo. We're going to talk about getting ready, breathing techniques, how to clean your device, and how and when to replace your inhaler. All right, so where does the asthma medication actually go? Well, we want it to go into the lungs, but as you can see from the first picture, if you're just using your inhaler, puff, puff into your mouth, most of the medicine gets into the roof of the mouth, back of the throat, and goes into your stomach. We really don't want that. We want the medication to go into your lungs. So when you're using a spacer, as you can see from the second picture, it slows down when you press, it slows it down through the tube and enables you, when you're taking a proper breath, to get the medication into your lungs. All right, so there's a few things I want you to know about using a spacer. We want you to know that how to prime your inhalers. We want you to use the proper breathing techniques when you're using your spacer with your inhaler. And we need for you to make sure you know how to clean that device. An important thing to know if you're taking a daily controller medication called an inhaled corticosteroid, that medication needs to be rinsed from your mouth after use. If you're using a spacer with a face mask, you also need to clean around the face and the nose where the mask was. Do not use a spacer with a dry powdered inhaler. So now there's a lot of new medications that are called DPIs, dry powdered inhaler, and those medications you do not use with a spacer. All right, let's get ready. If you've not used your inhaler in a while, you need to prime it. Daily medications like an inhaled corticosteroid, you prime it once when you get it from the pharmacy, and because you're using it every day, you do not need to prime it again. But your reliever medicine, your albuterol, your ProAir, your Ventolin, those medications, you need to prime if you haven't used them in a while. By priming, we mean to take the cap off of the medication, and you need to press on the canister. When the canister shows mist coming out, that means that your medication's primed and ready to go. All right, so after you've primed it, you're ready to use your spacer. One of the most important things you need to do first is sit up and put your chin slightly up. If your chin's down and you're going to press it, the medication's not going to flow freely into your lungs. So you need to sit up straight with your chin up. Okay. One of the other things you need to know is that one of the other things that you need to know is that you need to take a breath out if you're old enough to take a breath out before you actually put the spacer in your mouth between your teeth and a slight seal. All right, now we're getting to the breathing part. Once you've taken that breath out, you need to put the spacer between your teeth and close your lips around it. If you're using a face mask, you need to secure the face mask over the nose and mouth and a nice tight seal. Remember, you need to sit up and chin up before you actually press on your canister to release the medicine. Okay? You're going to spray one puff at a time. One puff, and then breathe slowly and deeply in and out. All right? Holding your breath. If you're old enough and you can hold your breath, we're going to hold the breath for a count of 10. This lets the medicine settle deeply into the lung. For children that can't hold their breath, they're just going to breathe in and out slowly for 6 times. With the albuterol, the reliever medication, if you're using albuterol, also known as ProAir and Ventolin, we need to wait 1 minute before you take your next puff. This allows the medicine to start working because it is a quick relieving medication. You do not need to wait a minute if you're taking an inhaled corticosteroid. Okay, that's it. You took your breath. You're going to put the cap back on both your inhaler and your spacer. And if it is a daily controller medicine, remember, we talked about rinsing your mouth or washing your face. All right. We're going to talk, actually, I'm going to do a quick demonstration for you. Okay, first I'm going to show you a demonstration without the face mask. You're going to take the caps off your medication and the cap off your spacer. You're going to check to make sure that it's clean. You're going to press until you see the mist. You can put it in, shake it up. And then you're going to take that breath out. Make a nice tight seal. And then exhale. If you've breathed in too quickly, you're going to hear a whistling sound. You don't want to hear that. You need to slow down your breath. All right. Next, we're going to use the face mask and show you with a face mask. Again, you're going to shake the medication up. You're going to make a nice tight seal. And you're going to breathe in and out for 6 times. And to ensure the medications. Remember, always wait a minute in between puffs. And remember, always shake the medication up for the second puff. All right, good. Now we're going to go to the device cleaning. We're going to talk first about cleaning the canister. Once you take your cap off, you look in and you check to see if there's any dirt or powder in there. If there is, you need to clean it. You take the canister out, it comes out very easily, and you place that down. You're cleaning only the plastic part. Warm soapy water, clean it, use a washcloth, and then dry it off. Now you're ready to go. Put it back together, and remember, shake it up before you're ready to go. When you're cleaning your spacer comes in several different pieces. So you take the face mask off, and any pieces that come apart, you can take them apart. Oh, okay, good. Now you got all your pieces, and you're going to soak them in warm soapy water. After you soak them for a while, you can rinse them and shake them and let them air dry. The most important thing is to never clean the inside. It has a anti-static barrier inside, and if you dry that inside, then it's not going to work well. All right, so that's cleaning, and here are the steps you can also read through if you have any questions. Also, we have a baggie. You can get a baggie, and if you put all your products inside the baggie, that'll keep them clean for a longer period of time. All right, so when to refill and replace your inhaler. Most inhalers come with counters on the canister. Here's a picture of one with a counter. When that counter gets down to 9, it's time to call your pharmacy and get a refill. If there's no refills left, you need to ask them to call your pediatrician and get the refills. So you won't miss any doses. All right, well, thanks for listening in. Here's some ways to contact us via email, phone number, and there's also a link here to our website with more resources for you to look through. Be well, thank you.